Welcome back to another episode of Questions with Crocker with me, Dr. Crocker, an emergency veterinarian and small animal general practice hospital owner. I'm usually joined by my husband, Shane, but he is not here today. Instead, I am flying solo for our 70th episode. I cannot believe that it's been 70 episodes. We've done this for a while now. We've gone to every 2 weeks with episodes because of life, but we really enjoyed it. And this podcast is based around your questions that you submit to us and things that are going on in veterinary medicine. We try to kind of pull the curtain back a little bit to being practice owners behind the scenes, private practice owners, I should say, not corporate. And I also share parts of my life as an emergency veterinarian, a working mom, and a partner with somebody that owns a business together. So if you are here, I appreciate you listening. If you would like to leave us a review, I would really appreciate that on Apple or Spotify. It's been a little while since we've had new reviews, and I know things are slower with the podcast only coming out every 2 weeks. So I appreciate anyone's support that wants to go and drop a nice comment. You also can watch us on YouTube, or you can listen to us on Apple or Spotify. And you can actually interact live via text message on Apple. There's a link at the top. So if you hear something and you're like, ooh, I want to comment on that, or I have a different perspective, or I want to give some information to us, you can go and push that text link and it will come right to us. That is it. That is the intro. It's always long, but it's important to say for anybody who is new here. A couple updates if you have not been with us recently. We are in a little bit of a slower time, not with our family because our kids are crazy busy, but I am home more. And so I'm not traveling as much. I've said no to a couple different things and conferences, really trying to be intentional to be here. I have a new veterinarian starting at the practice in May, really trying to set up the team for success. We had to hire a couple new people. We're growing the team. It has steadily been busy. Today, I helped out a little bit in the call center, and it was awesome to start the day with 7 new client requests for people who wanted to come over to our practice. So we're really trying to get the word out that we are a practice that is going to be accessible, is going to be affordable. We're going to try to have same-day appointments for urgent care services. And we also provide quality care. 2 of us used to work ER specialty. I still work emergency shifts. And then all of us have been in practice for 10 plus years. So it's nice to have that level of experience, both surgical and medically. And we like that we can try to offer high quality service at an affordable price. That being said, the economy is a little scary right now. And there was definitely days last week where it felt like it was a little slower, and maybe it's harder to get people to take some of your recommendations for diagnostics or lab work. But my husband always says we can't just go off of a feeling. We have to look at how do we actually do for the day? And are people truly saying that they are not going to do diagnostics like they used to? So the great thing is, if you are feeling a certain way about the economy right now as a practice owner or as leadership in veterinary medicine, I really encourage you to actually look at your books, to look at the last quarter and see from last year how many people are doing their annual preventative lab work. How many surgeries are we booking right now? What is our average client transaction? And kind of get a sense of, are things different? Should you kind of change a little bit your recommendation? Should you increase your marketing, or is it really not as bad as you think? And I feel like that's what's happened with me. I'll have days where I'm stressing out a little bit, and then I'll actually look at things and look at the numbers and look at what all we accomplished just with helping pets and the people in our area, and I'll realize that we're still doing really, really well. So it's weird how your emotions can kind of get ahead of you and you can almost overthink things a little bit. So definitely look at the numbers, and that will help you out a lot. Less travel and also working a little bit less emergency overnight shifts has just helped me mentally. I think I kept joking that I was just getting old, which I did have a birthday just a couple days ago, but I kept telling people like, I'm getting too old to do this. But I think I was really just running myself to the ground. I was traveling too much, wasn't sleeping enough. I wasn't eating as well as I should be. I wasn't working out as much because I was tired, or I just had a lot on my plate. So just trying to be more intentional with prioritizing the things that I know in the long run will keep me going. I am getting older, and this job is really, really hard on your body. So it is important to prioritize all those things. I also am like a Shih Tzu. I have really, really severe dry eye. And once I tell you that, you will now always talk to me and look at me and see how much I actually blink. I apparently, according to the ophthalmologist that helps me out, basically have zero tear production, and the tears I produce don't like to stay in my eyes. This has made me really sympathetic to our pet patients that have dry eye, or what we like to say is KCS for pet owners who are listening and not sure what we're talking about. So you have pets also that will develop this. And for me, I'm on 2 different medications. I take them twice a day. I take eye drops throughout the day. And I am looking at maybe some other therapies that will help me overall. But it is something that will likely progress, will likely get worse, and is extremely painful. It is really hard to feel like your eyes are sandpaper and not be able to get relief 100% for that. So I'm very acutely aware of how much I blink when I'm talking to people, try not to be self-conscious about it. Our pets don't get to experience that, but I do think they really experience the discomfort. And I think a lot of people aren't as diligent with eye drops for dry eye in pets as they should be. And I am here to tell you it is a painful condition. It is difficult to deal with, and I think our pets experience the same thing. So if your vet is recommending that they test for dry eye, it's a shimmer tear test. It's really simple. Any general practice vet can do it. And especially if your pet is diagnosed and they're recommending medications or eye drops, please use them. Please, because it's only going to get worse. They'll get a film over their eyes. The eye will just get drier and drier, and they'll be uncomfortable. And we don't want that for our pets. It is also interesting that when I was at the ophthalmologist, they were saying that dry eye is really, really common in healthcare workers that work nights in really cold, dry environments. And I was like, oh, like an emergency veterinarian who only does overnight shifts. That is shocking. And so she made a couple great recommendations in saying that I should start to carry a diffuser with me and actually put it on my desktop. And I do that now. And when I'm sitting at my desk working on records on an overnight shift, it really helps me a lot. So it's crazy how there's like little things that you can try and do that really will help maintain your health overall. But apparently it's really common, and I'm not changing my job anytime soon. I love working emergency overnights, so just going to continue to try to support and adapt. But if anyone listening has dealt with severe dry eye or knows someone who has and has any other tricks or recommendations, please reach out. I would take any and all. I will try anything at this point. I really don't want to have to do any more extreme measures if I don't have to. That being said, let's talk about some more pet conditions and pet cases. I had a really fun case the other day. It's a really common one. So I had Buffy the Sphinx, so naked kitty, and she was adorable, and she presented to me for coughing. Now, coughing in a cat can be just a slight cough that maybe is happening with a little bit of tracheal irritation. It could be something much more significant like a pneumonia or fluid in the chest from heart failure. And then it can also be asthma. I do feel like the cough maybe varies a little bit, and I always feel silly in exam rooms, but I will try to portray to pet owners what that cough is. And so I'll ask them when I'm thinking about something that is more of a heart failure or pneumonia, like, is it a deep, wet cough? Are they... Or if I think it's something more asthmatic, it almost looks like they're trying to throw up, and it's more of a hack. And that will be kind of a difference. And a lot of times I will try to get people to bring videos of the coughs that they're seeing in their pets, because it will really help me differentiate. When I have a cat that is coughing, obviously we're going to do a really good physical exam. So we're going to listen to the heart, we're going to listen to the lungs, but that doesn't always help us with cats unless there is a large amount of fluid and there are a really significant heart murmur. It is known that there is a large percentage of cats that can have heart disease without having a heart murmur. And so that makes it harder to diagnose them overall. But coughing can be an early sign of heart disease worsening, as can respiratory rate. So elevated respiratory rate, most of the time pets should be around 30 to 40 breaths per minute. If they're getting up 50, 60, then I would definitely be concerned and have them checked out. So ultimately what we were left with is I was suspicious because this cat's lungs sounded okay, the heart sounded okay. and did not have a fever, which you sometimes will see with pneumonia. I was suspicious of asthma. And with asthma, you really need to get x-rays. And we wanted x-rays anyways because with the type of breed, she was really concerned that she could also have heart disease, and we need to know that. So we did recommend blood work, chest x-rays, and the owner approved that. She's a wonderful, wonderful pet owner. And so the lab work really was unremarkable. And the x-rays showed that the heart was normal in size and there was a bronchial pattern. So there was suspicion for asthma. Now, the tricky thing, and this is the fun part of being a veterinarian, is you treat asthma usually with steroids. Sometimes you'll start out with orals and eventually you'll transition to inhaled steroids. And then sometimes you'll also have an inhaler that's a bronchodilator, like albuterol, for if they're having like a really severe attack. But the issue is if a cat has a heart condition, you do not want to put them on steroids. Steroids can actually make a heart condition much, much worse. And so we really needed to determine if there was any underlying heart issues before we started this cat on steroids, ideally. And since she wasn't having like huge attacks asthma wise and she seemed to be pretty stable, the owner wanted to just do a really thorough workup. So we recommended a pro BNP, which is a cardiac enzyme, and if the heart is overworking, then that value will be elevated. It's a good screening tool, but it is not something that if it's normal, you can say a cat does not have heart disease. If it's abnormal, then that definitely helps tell you that the heart is working too hard, right? But it is not something that will definitively rule it out. The best thing to do if you're really worried about a cat's heart or a dog's heart or any heart is to do an echo. So to take a look at that heart with an ultrasound and do a cardiac ultrasound workup. That is something that should be done by cardiologists, in my opinion. I know that a lot of people are really great at ultrasounding and can do these. I think the added benefit of having an actual pet cardiologist do an echo is they can then make a lot of really great recommendations, and they're up to date on like the most recent data. So if they see something abnormal, then they can really tell you, one, what stage of heart disease it is, when the pet should be rechecked, and if you should be starting any medications. We know we can't reverse heart disease, but we do know that we can help to maintain those pets as long as possible, especially with medications that are going to help the heart not to work as hard. The heart is a muscle, so if it's working harder, it's getting thicker. As it gets thicker, it can't pump blood as effectively, and that's where you'll start to get heart failure signs and a buildup of fluid. So lots of different considerations, but ultimately, all of her tests had checked out pretty well. We were going in the asthma direction, but our last test that we're going to do is we're going to have our traveling cardiologist that comes to our general practice actually do an echo on Buffy the Sphinx and make sure her heart is in good condition before we start any sort of steroids. I'm really happy to have an owner that's willing to kind of do the whole workup, make sure this cat is healthy so we can give her her best life possible. But it is really tricky when it comes to heart disease or heart issues in patients. And I did make a video on social media talking about how you can look at your pet's respiratory rate and kind of get a sense of what their normal is, especially when they're resting. And then you can use that to sometimes help you determine if you feel like they need to get a checkup, if all of a sudden it does look more elevated. Well, that turned into a big discussion about respiratory rate and heart rate and all the things. And so one of the questions that I got was at Sunshine Petals says, can you teach us how to check the heart rate in your pet? And so I do think this is, for me, coming from a pet owner perspective of how can you check the heart rate. And I actually will recommend how to do this a lot in the emergency setting because we'll have pets that maybe ingested something that was a stimulant or ingested something like THC, which could cause depression. And sometimes pet owners can't hospitalize, and we'll watch them for a little bit and we feel like they're stable enough, then they will go home. But a lot of times I will show owners how to check a heart rate and talk to them about if the heart rate is too low or too high that they need to come back into the hospital. And so one of the main ways that you can do that in a dog or cat is you can actually check on the femoral artery. So where the legs come together at the very top on the inside of the thighs, you will actually feel the pulse, and you can feel the pulse pulse, which would indicate when the heart is beating. And that pulse that's up there on the inside of the thigh, kind of up in the hip area, is going to help you to determine what the heart rate is. So what you would do is feel for that pulse, kind of like we would feel for the pulse in our neck. You feel for the pulse right there on that inner part of the hip thigh area. And once you feel the beating, what you want to do is either measure and count for 6 seconds and times it by 10, or some people will measure and count by 15 seconds and then times it by 4. I do the 6 and 10 because it's easier for my brain and I don't have to work as hard at it. And I might do it a couple times and then average them out. But that is a really great way to check it if you don't have a stethoscope. Now, if you do have a stethoscope, the point of the heart on a cat or dog is usually right where the elbow goes if you bring the elbow back. So when you're listening, that's about the rib area that you want to listen. And a lot of times, in smaller chested animals, it's easy to pick up. In bigger dogs, it might be harder. You want to go lower on the pet, on the chest than you probably think you need to really hear that, especially in big animals. And so that's one way you can do it. If you have a stethoscope, you can listen and count for 6 seconds, times it by 10, or 15 seconds and times it by 4, or you can pick up that pulse. Now, some of you might be horse owners, and this is always a really fun one for me to teach people when I was an equine veterinarian. You actually can find the pulse in a horse really easily. And there's 2 places that I would recommend you do it. One is they actually have a really large artery that runs right under their jaw. And so it runs kind of from the outside down under their jaw. And you can put your fingers on the inside of their jaw and you can actually feel that pulse. And you can actually feel usually the vessel. If you trace along the jaw, you'll kind of feel this little bump or ridge. And that's a lot of times the vessel. If you gently put your finger there, then you should be able to feel the pulse. The other thing is on the back of a horse's foot, ankle area, there's arteries that run down either side. And so sometimes, especially if they're having issues with their foot causing more inflammation, like laminitis or an abscess, you can actually feel on the back, you can feel the arteries and veins, and you can put your fingers there lightly, and you can also check the pulse that way. So just some fun ways to check it as a dog or cat owner or a horse owner, and hopefully that helps. Same thing with respiratory rate. If you're worried about your pet's respiratory rate, you can definitely watch that. You want to do it while they're resting. A lot of people don't think about the fact that it's going to be elevated if they're excited or things going on. So I definitely recommend while they're napping or resting that you're going to look at them and you're going to count it for the 6 or the 15 seconds, and then you're going to multiply it. And again, 30 to 40 is ideal in dogs and cats. And if it's getting up 50, 60, and that's not normal for them, then you definitely want to have them checked out by your veterinarian. Horses are going to be a lot lower. They're sometimes going to have like 8 to 10 as their respiratory rate. It's very slow. And so don't stress out about it being too slow, but definitely be concerned if it's getting up a lot higher. I have a couple other questions, but I thought it would be interesting to actually go over some recent information that came out, especially because we're heading into a couple of holidays. So I wanted to go over the top 10 toxins in dogs and cats. And so this is from the Pet Poison helpline, which they are wonderful. They get phone calls from pet owners when pets ingest things. And honestly, when I'm working in the emergency room, people will call all the time and they will ask us, my pet ate this, what about this? And sometimes I do know what to tell you. And sometimes I do have calculators that I can check for different types of chocolate and things like that. But because so many things nowadays are not just one thing, there's multiple things involved in ingestions. A lot of times we do recommend that pet owners reach out to Pet Poison Helpline. Now, there is a cost associated with that, or with the ASPCA Poison Helpline. And I have some younger veterinarians that ask me well, how do you explain to them why there's a cost and the value of the cost? Because a lot of owners are like, well, I don't want to pay $75, $80. I just want to bring them in, or I just want you to tell me. And so the way that I kind of explain it is I will tell them, honestly, it might be the best money that you spend, because I probably 50% of owners that will call in a panic to Pet Poison Control, and they will say, my pet ate this, and this. And Pet Poison Control is so informed that they are able to take your dog's weight and what they ate, and they are able to tell you exactly what to do. So I think they tell a fair amount of owners, listen, they might have a little bit of loose stool, monitor for that. But really, you can keep them home and watch for A, B, and C. Or if they talk to you and they say, no, you need to go to the emergency vet immediately, I really need to get there because time matters with poison. A lot of times with ingestion of things, we can induce vomiting to get some things out. If things are rapidly being absorbed, sometimes we can give them things to help with nausea, and we can actually give activated charcoal. And then sometimes we can give things like intralipids to bind them. But there's a lot of different ways that it can go. And honestly, if you spend $75 to $80 for them to tell you, yeah, stay home, they might have diarrhea, don't stress about that. I think that that is worth it, and it's worth the money, and it's going to save you what is much more when it comes to an emergency visit and an exam and all that. So let's go over the top 10 toxins according to Pet Poison Control. So for dogs, number 10 is onions, chives, leeks, and garlic. Get this phone call all the time. People drop it on the ground or they accidentally feed their dog something with it in there, and it will cause some issues, especially with the blood of the pets. And so really important to make sure that you know how much they ate, what their weight is, and they can help you with that. Carprofen, which is an anti-inflammatory. Now, the great thing about it is it comes in a chewable. That means it tastes really good though. So 100%, probably monthly, we get a dog that decided to eat all of its anti-inflammatories in one sitting. And it can definitely cause really significant organ injury. Vitamin D3 supplement. I think a lot of supplements can cause issues if they're overdone. And so this one can be common because people have that around and it's a really big concern. Number 7, anticoagulant rodenticide. So they actually emphasize anticoagulant rodenticide because you can treat that. You can give vitamin K most of the time, and you can actually help prevent some of the side effects that can happen when the body is trying to all of a sudden not coagulate the blood like it should be. Number 6, marijuana, THC poisoning. We talk about it all the time. Number 5, ibuprofen. I actually got my rescue dog because he ate 2 bottles of ibuprofen and completely trashed his liver and had to be hospitalized for quite a while. So I do think that is an important one to keep locked up. Xylitol flavoring, xylitol gum. Xylitol is a sweetener used in humans stuff, and it will definitely cause a very severe life-threatening hypoglycemia. So it'll cause the blood glucose to crash. These pets will come in seizuring, and they can have very significant issues. Actually, they come in seizing. The other day, someone corrected me that it's seizing and not seizuring, but I think I've said it for so long, it might be hard to change that overall. Number 3, bromethylene rat poison. This is the one that is causing neurologic issues. It is much more significant. It is much harder to treat. You basically have to support them through it. So really important if they eat rat bait that has bromethylene in it that you immediately go to your veterinarian and try to get them to vomit it up. Number 2, grapes and raisins. Grapes and raisins, they now are saying that 1 grape per 10 pounds may be okay, but it is still something that I would call the veterinarian and call Pet Poison Control and give them your dog's weight and then let them know what happened. And to be super safe, even if you're going to monitor, I would probably check their kidney values 24, 48, and 72 hours. And number 1, chocolate, really common. Again, the extremes of white chocolate probably causing not that much of an issue versus really dark chocolate or baking chocolate, significant issues are there. So there is a chocolate calculator that a lot of vets have access to. This may be one that you could call your veterinarian and check with them. But if the chocolate is mixed with other things, we may still want to call Pet Poison Control so we have a good idea of what to do. All right, on to the cats. And I think it's timely what some of these are. Number 10, tulips. Yay. They're really cute, but your cat, if they eat them, can have some issues. Number 9, carprofen. Cats will eat dog carprofen and dog anti-inflammatories, and their bodies do not like it. So keep those away. Number 8, amphetamine combos. Honestly, I am not entirely sure what that would entail, but it doesn't sound good. Number 7, vitamin D3. Again, really accessible because people use them. Number 6, now this is where we get into what's about to happen, which Easter's coming up. So the number 6 toxin in cats seen in 2024 was the Peruvian lily. And we see lily toxicity much more commonly during Easter. So really important to be aware of that. Number 5 is ibuprofen toxicity. Again, human medication. Cats eat off the floor usually, that you drop it can cause really significant issues, especially because 1 pill can really equal a lot of issues, and that's all it takes in a cat. Number 4, garlic. Drop it on the ground, they eat it, or feed them something accidentally. 3, onions. 2, chocolate, which I do think is weird. I mean, my cat eats a fair amount of things. I don't know that he's ever gone and tried to eat chocolate, but maybe it was mixed with something else. And number one, again, back to Easter, the number one cat toxin of 2024 was lilies. And these are true lilies. And so if your boyfriend, girlfriend, partner, spouse, friend, coworker has a cat, do not buy them lilies. And it's funny because it seems like we say this every year as the vet med community, and people will still go and do it. And it is not even if they eat the plant. Pet owners have to be aware of this, and so do veterinarians. It's just if they have the yellow staining on them from the actual pollen in the middle part of the flower, they need to be washed immediately. They need to be decontaminated and potentially be put on fluids depending on how much they might have gotten into. So those are the top 10 cat and dog toxins of 2024. Hopefully that helps a couple people out overall. I will say that I was seeing a lot of different things that were happening in our veterinary community. And I feel like a lot of this podcast today has been a little bit geared towards pet owners, but there's a lot going on. There's been a lot of different vet clinics that have actually closed suddenly. The economy is really rough. I think social media is even rougher on a lot of people in our community right now. And we're not always great at supporting each other. We're really, really good at pointing out each other's flaws and tearing each other down. And so that has been really, really tough. Along with that, Florida is trying to pass a VPA bill. I believe it's passed the House, but they don't think it's going to pass the Senate, is what people have told me. But this is something that we're pretty concerned is going to change our industry in a dramatic way. It does look like the Colorado bill that passed did get a lot more parameters put in place for it, and they're now saying it won't come into effect until like 2030, which seems like a while away, but then sometimes I think about how quickly the last couple years have gone owning a vet practice, practicing as an emergency vet, and I'm like, it's actually not that far away. Like 5 years is not that far to figure out a completely new position in veterinary medicine, how it's going to work. We are having new vet schools open, along with the fact that we are having vet clinics close, and I do think that there is still a need out there for veterinarians, but the problem is that the ideal jobs in the ideal areas are going to become more competitive for them. Now, as a practice owner, I'm not going to lie and say I don't look at it a little bit and say, okay, maybe we'll have a little bit of balancing out of some of these salary offers that are being made to new graduates, because we're seeing such massive ones from some of the corporate entities or people that just can't hire. And it's really hard to compete as a private practice owner. I know I pay my veterinarians well, but I cannot afford to give them $60,000, $100,000, $200,000 bonuses. It's just not in the cards. And so I'm hoping that maybe this will balance things out a little bit. And as a vet student, I really hope that people are aware that, yes, there's big numbers out there, but what you really want is longevity and support in this career. And the first couple years out, or even first couple months out, will really set you up for success and give you a good foundation. So you want to go to a practice where you're really supported and it's busy and you're going to get a lot of hands-on training and teaching and mentoring. And eventually that is going to turn into you being a very successful veterinarian, even financially. But that upfront number is not always the most important thing. And I do think that while salaries needed to raise in veterinary medicine, and I think we're doing a better job with our support team members, I still think we could do better there. And I would rather pay support team members more than paying a brand new grad vet a number that I can't justify for the first couple years because I need a warm body. And this is probably too straightforward. Some people are probably not going to like this. I'm not saying they don't deserve it, but I do think in some ways you have to earn it. And I think you can, but you have to give it a little bit of time. This is also coming from somebody that graduated during the 2009 recession, and my first job was an internship for $30,000, and my second job was a equine job where I started out at $60,000. I did a lot of emergency work, and I was so excited to make $80,000 after pretty much working 50% of the time on call and 6 days a week. It was a ridiculous amount of hours to achieve that. And I do not recommend that being the case and us going back to that, but I do think that you're going to see maybe things even out a little bit, but we'll see. I'm interested to hear feedback on that. I'm interested to hear what you think of the podcast. I know it's me talking alone by myself a long time, but this is just such a nice platform to be able to get full thoughts out. I felt a little stilted on social media recently because everything I want to say takes more time than 15 to 30 seconds to catch people's attention. And I'm trying to find a way to kind of get out the important things and create conversation and create community and make people laugh and have fun. And sometimes I just put up a video that is something a little sassy or something that's really veterinary humor. But I really want to continue to encourage conversation because I think there's a lot changing in our industry right now. There's a lot happening. And I think we need to be a part of the conversation and not be just watching it happen, especially as practice owners, especially as people that have been in this career long enough to know what it was like, what it could be. I really think that we have to continue to be engaged, and I really hope that the younger generation comes along and continues to be engaged. Some of the older ones, they can go retire. I appreciate their input, but things have just changed so much in the last 10, 15 years that I think if you graduated really before 2005, 2000s, I think it's hard to wrap your head around. So we will see what happens. Again, if you want to watch, you can watch on YouTube at Questions with Crocker. If you want to listen, you can listen to us on Apple or Spotify at Questions with Crocker. You can always submit a question on any of the social media platforms or on our website or on our email. You can pretty much find us anywhere. And if you really want to be a wonderful listener, you could go leave us a review and give us some feedback. I keep saying us. My husband's not here this time, but he will be back in the future. Thanks so much for listening and have a wonderful April.